is Dr. Clark. I'm the program director for the Masters of Athletic Training program. This is Tamicha Ingram. She is going to do her talk this morning on managing attention deficit hyperactivity disorder, or ADHD, in collegiate athletes. So I'm going to turn it over, and she is a Masters in Athletic Training student.
Hi, as you stated, my name is Tamicha Ingram, and I am a Master's in Athletic Training student here at Jacksonville State University. And my topic is managing attention deficit hyperactivity disorder in collegiate athletes. So just to get into it, ADHD is a behavior disorder defined by chronic and impairing behavioral patterns that result in abnormal levels of inattention, hyperactivity, and impulsiveness. ADHD is a common brain condition that affects an estimated 3 to 7% of individuals worldwide and roughly 7 to 8% of elite athletes. It is most commonly seen in children, but it is a condition that persists throughout one's life, and collegiate athletes undergo a lot of stress due to academics and the sport that they participate in. So with ADHD, you require a proper diagnosis from a licensed healthcare professional. Most professionals use the Diagnostic and Statistical Manual of Mental Health Disorders, or the DSM-5. It is a detailed book that is used by licensed professionals, and it contains descriptions, symptoms, statistics, and criteria for diagnosing mental health disorders. It contains a series of assessments that examines one's past medical history, learning styles, memory, cognitive function, social function, reasoning, and communication. And proper diagnosis can help individuals understand their condition, since there are 3 different types. So 3 types, you have primarily hyperactive and impulse, primarily inattentive, and combined type. And the type is based off of what they present with. So just some considerations for ADHD patients: you can consider symptom reduction, functioning improvement, quality of life improvement of core conditions, and then safety and tolerability of medications. And treatment can be divided into 2 domains: behavioral interventions and medications. Behavioral interventions include physical exercise, cognitive behavioral therapy, skills training, and support groups, and medications are prescribed by a professional. So this posed my clinical question: does physical exercise or medication improve ADHD symptoms in collegiate athletes? My participants were collegiate athletes. The intervention was physical exercise and medication, and the outcome is improved ADHD symptoms. So while going throughout my search, I used the JSU Library, Science Direct, Sports Discus, and Medline, and some of my keywords were behavioral interventions, aerobic exercise medications, and ADHD in collegiate athletes. So just some inclusion criteria, I wanted to make sure I included attention deficit hyperactivity disorder. Interventions were physical activity and medication, collegiate athletes, and then studies that were published in the English language. Some exclusion criteria were studies about autism, any studies that focus on anxiety or depression, studies that discuss concussions, and any studies that were published greater than 10 years ago. And for my evidence quality assessments, I used the Pedro scale, the SANRA, and the stroke checklist. These are the articles that I included in my presentation today, and this is just how they were graded based off of the type of studies that they were. So some were a narrative view, a case control study, and a meta-analysis and a literature review. So for my search results, I chose 4 studies, 2 focused on physical activity, 1 focused on medication, and the other focused on all aspects. Acute effects of physical exercise in college students with ADHD. So within this study, they focused on high intensity interval training. So HIIT is a form of physical exercise with alternating periods of explosive or intense aerobic exercise with short periods of recovery until the individual reaches exhaustion. So they use a lot of cycling and running. And I've realized throughout this study is that there's still more research that needs to be done regarding the effects of HIIT in collegiate athletes and individuals with ADHD, but based off of the results, it can be beneficial. So attention deficit hyperactivity disorder in elite athletes, this was a narrative view. It condensed the literature of the diagnosis, prevalence, effect on performance, and management of ADHD in elite sport athletes. Sports participation can be a physical outlet for intense emotions and stress, and medication management usually divided it into non-stimulants and stimulants. Attention deficit hyperactivity disorder in athletes. So most D1 athletes are under the regulation of the NCAA, and college athletes can be summoned to a drug test at any time, so you have to have records of when they were diagnosed and what medications that they are on, so that way if it does pop positive on a drug test, they would not be removed from sport. ADHD and physical exercise. Aerobic exercise interventions can reduce short and long-term symptoms. Daily exercise may improve symptom relief, and physical exercise has not shown any negative effects on ADHD symptoms. So just a summary of my results. Prescription medication is usually recommended first. Every athlete will have a different physical or psychological response. Physical exercise does not aggravate any symptoms, and each athlete requires an individualized approach. So my clinical bottom line, research regarding ADHD in collegiate athletes is limited. Each athlete requires an individualized approach. Physical exercise can reduce ADHD symptoms, and medication can ease ADHD symptoms. Health implications, proper and accurate diagnosis of ADHD is necessary. Physical exercise causes an elevated release of neurotransmitters in the brain. Prescribed stimulants and non-stimulants can be taken to alleviate symptoms. In conclusion, ADHD disorder affects all populations. Athletes with ADHD can participate at all levels of competition while undergoing treatment, and physical exercise and medication can be used simultaneously. Here are my references. I just want to say thank you to the JSU Symposium for allowing me to present. Thank you to my classmates and my professors, Dr. Savage and Dr. Clark. I appreciate it. Thank you. Any questions?
You mentioned that exercise helps, or it may help. Do we have a theory about like why? What's the mechanism?
So with exercise, it helps with the hormones in your brain. So you're allowing it to be a release. And most people with ADHD, since they are hyperactive, the release from the exercise will cause their nerves.
Thanks.
Any other questions?
All right, let's thank our speaker again.